Good morning. Good morning. I brought the Marines today to help you. John Henry was a helicopter and fixed-wing pilot in the Marines in Vietnam. He was the first Marine pilot ever double certified in fixed-wing and chopper. And he is responsible for the PTSD protocol. My Marine that I carry around with me is Gunny Gibbs, and he was a special ops after the 2003, and he went to Africa and he was with NATO for like 8 or 9 years. And he was the one who was responsible for teaching me about the go-go and how we cleared it in 60 minutes. When you go into the military, you go into the military and they train you. They train you by drill to perfect skills that you're going to need in the battlefield. And then when you have those skills perfected, then you can go and get assignments. You go out on your mission, and your mission is to do whatever it is and come back alive and bring your buddies back alive also. It's a hand grenade. He's fixed to her left knee.
Oh my word, what an incredible performance. So good, military precision, inventive. It's one of the best performances I've seen in this competition over the years.
That's the military, just so you know. These are people who are different than civilians. The next is Harvard Inner Life of the Cell. It's a collection of work by cellular biologists at Harvard. This is 2006, and they have a series of these. Another one I really like is mitochondria. But this is, I'm going to take you into the inner life of the cell, and we want to look specifically at the microtubules, which connect all the meridians and the chakras, and they are the major conduction system of your body. And we also want to look at the mitochondria because of the powerhouses. So there's, those blue things were the activated lymphocytes, and you saw the red, activated lymphocytes. They're on a mission. And this is lipid membrane stuff. Surgeons don't care about lipid membranes. These are actin fibers right there. They support like the tent structures of the cell. And we're waiting for the microtubules to show up. Connect the points in the body to the chakras, and they interconnect everywhere across the midline, everything. This is actin. There you go. Oops, oops, oops. This is what I show. This is what I show to every patient that I see. The Marines like to know who they're going to kill, okay? And so I show them. These are the microtubules that have been studied for quite a long time, but these it reminds me sort of like a plastic zipper, they interlock, but these are the channels that carry the energy into the cell and around the whole body. See, and they're forming now. They have a hollow center. And then we got to go to the next part, which is the fun part. That is smush. These are the microtubules that are disintegrating under the effects of photons, electrons, and phonons. And you know how to do this. The massage therapists know how to do this. You know how to break up the crap. And so then these bad memories, they go off into the extracellular fluid, they go to the kidneys and the liver, and you have a detox reaction. And that is it. That right there is how you treat PTSD. But I got to show you my other buddy. This is the the myoprotein. And you see he's got these big clunky electric boots on, and he's walking along the microtubule, and in the vessels are the secretions of the cell. And he's taken them out to the cell membrane and put them out in the circulation. These are all the microtubules that go into the centriole, and this is all electrical, and here is the big fat old mitochondria, and there's another one there. And you notice how this dude is like laying on the microtubules because he's getting his electric current from that, so he can do his thing, which is run the whole cell. You can go and you can see that. There's a reference. Here it is. YouTube? Yeah. Okay. So that's the reference for, in the back of these slides, there is a whole bunch of references. This is the work that was done from 93 to 2010, 12 by Hemmeroff, who's here in Arizona. And this is a resting cell, a normal resting cell. The cell is at ease, as we say. And this cell over here it's at attention. And when the cell goes at attention, it's because it's been triggered by some environmental stimulus. When we go to attention, it's a subconscious maneuver, and we see the brass coming along, we see the American flag coming along, and we do this attention. And it's also a way of communicating. So he studied this a lot. And this is what he did. This is the electrical conduction system of the microtubules of each cell. This is muscle memory. On the cell are these little muscles, the little muscle memories. And this is, Bruce Lipton says 90% of all your behavior is from the memory in these cells. And you know that this is true because the transplant nurses have patients that come in. There was this vegetarian lady, and she was a vegetarian all of her life, and she started having terrible urges to eat McDonald's quarter pounder with cheese twice a day or 3 times a day. Well, her heart came from a biker dude. And then there was this wonderful cheerleader, sophomore cheerleader, and she got a liver. And she turned into this very serious, introverted person, and she started doing woodworking. And her parents are going like, it's not my daughter. And then she met the widow of the policeman who had given her his liver, who was a woodworker. All right. In the 1960s and 70s, Bruce Lipton was a cell biologist, a renegade. This is participation time. He took myocytes, and here's make your myocytes. Everybody make your myocytes. You don't have to stretch it out. And he put them under the electron microscope, and he exposed them to fear, and what happened? They drew microtubules on the surface because they were trying to remember everything about the fear. This fear drives this production. And if you do this, you guys are fading out. If you do this, you get your muscles start to hurt because it takes energy to maintain these tubules, okay? And that's why we have decrease in resiliency after troops have been out there. They collect all these and then they get them. Anyway, nobody believed Bruce Lipton until, see here we got 89, another group of cell biologists, and they said, oh yeah, we got microtubules. And that is the explosion. All right, so the mechanism of the smush and the mechanism of this explosion stuff. When you have cells, they are not in separated little petri dishes. They're all clumped together. All the muscles are clumped together, right? And so they see something that they're going to be attacked by, and they go into like this, and they all intertwine all their microtubules. And so there's that area there of microtubules. So if you try to examine these guys, they have what they call, that's what Gunny said. He said, put your hand on my chest. He had brawny edema everywhere in his body, and you can feel it. But then once you laser off that, those microtubules, they go back down to being soft and smushy again. All right, now I want to take you to this topic, and I get really angry, so I have to control my anger. In 1871, the Civil War surgeons were taking care of the veterans in their hospitals, and this guy, Descartes, he recognized with his stethoscope they had irregular heartbeats. They were like tachycardia, and he said he'd never heard anything like this before, except in those soldiers. So he called it soldier's heart, published the paper, and said it was autonomic dysregulation. Then in 1971, when I was an intern, I was examining this woman who had 4 children vaginally. She lived up in the north where it was cold. She's a very strong lady. And I did her upper part of her exam. I got her legs up to do her pelvic exam. And I tapped, I must have pushed against her thigh because she shot up the table 3 feet away from me, knees closed. And so I said, well, did anybody ever hurt you during a pelvic exam? And I have my gloves on. She had no response. And anyway, we were able to get the pap smear and the pelvic exam done, but neither of my very wise attendings had any clue of what was going on, and not medical school I didn't teach anything. There was nothing in the textbooks, in the literature, about what this is, so I called it vaginal body memory. The vagina knew something, and it wasn't going to talk to me about it. So now, if you go on the web, there is a blog for vaginal body memory people. Oh, this is from 1980. It's the Diagnostic and Statistical Manual for the clinical psychologist, and it's a bunch of symptoms that they used to create this thing of PTSD, and it's a billing code, and they collected symptoms. Clinical psychologists are not allowed to examine their patients, so I don't know how you could possibly do a diagnosis on anybody. Since I'm a surgeon, you have to use your hands, right? Where's my doctor? Is she here? There? No. The surgeon, where's the plastic surgeon? She's not here. Oh, there she is with a baseball cap. You have to examine the patient, right? Yep, see? All right, the talk is really on PEP. Photons, electrons, and phonons, the subconscious reality. The important thing to take away from this is that the cell has a membrane, and it's the brain of the cell. And we're going to talk about cell danger response, and we're going to talk about mitochondrial repair. And then I have to tell you about my daddy. My daddy was wonderful. He was a Navy, World War II, and we had a farm. We had a vegetable garden, and I sort of helped him. And he said, we gotta. This chicken is not laying eggs anymore. We gotta make her into stew meat. So will you help me? I said, sure. So I grabbed the feet, and he took his really sharp hatchet and stomped off the head, and he picked up the chicken and put her on the ground, and she ran around with a little blood coming out of her carotid arteries. No prefrontal cortex, no motor cortex, no visual cortex, no cerebellum. She ran around like that because she knew, her cells knew she had to get away from that evil man with the axe. So that, I prefer that you would use, when you think about patients, think about if their behavior is they're running around like a chicken with their head cut off, because that's what they're doing. It's subconscious. It has nothing to do with talking. All right, now I have to present Dr. Robert, whatever his, how you pronounce his last name, 2014, 13, he came up with the cell danger response paper, which is a survey of 60 years of cell biologists working under their microscopes, evaluating cells. He said there are 6 different types of cell biologists, and I'm like, okay. But what they found is there is only one single pathway when the cell gets attacked by danger, and that does the same cascade of events, and one of them is releasing cytokines. And you know, McMakin has already showed that we know how to get rid of the cytokines right away, so we can reverse part of that immediately. The sooner, the better. The most important thing is right down here is that the mitochondria, they found out, trigger their cell's danger cascading sequence to protect the cell from whatever mitochondrial, whenever they sense a fall in their electron output. So if the mitochondria say, I'm losing my electrons, like the captain on a submarine, they push the dive button, they go, dive, 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 and the cell goes into this effect. And this part is why we get such great results, because we restore electrical flow into the mitochondria and heal it. This is a wonderful diagram. Right, doctor? Yes. And this shows the memory on the cells and the traumatic memory, but most important, the mitochondria, which produce the ATP, which are the batteries of the cell. There are 2,000 mitochondria in every muscle cell. There are 2,500 mitochondria in every heart muscle cell, and all the rest of it. Anyway, so here is an entry pathway, the blue side, photons, electrons, and phonons. Now, one thing that brings it in. Oh, so we already did that. This is Jim Osman's the connective tissue pathway, which Becker and Hulda Clark used, and it's all run with the meridians. And the difference between this side, which is conscious, and this side, which is unconscious, is the speed of conduction is like at the speed of sound or the speed of light, and so it's really fast to get people out of danger. That's why they use this in the subconscious reactivity. They use it on the battlefield all the time. This is what it is. This is where the microtubules and the autonomic nervous system, that are not myelated fibers, they run into this area here. He calls it fascia. Surgeons don't call that fascia, but it's the filmy stuff, and that's where they run, and they go into all the cells, into the network, because we're a bioelectric being. Now we're going to go to the other side, and this is capillary flow, and the other input is through the red blood cells, corpuscles. All right. RBC clumping. RBC clumping, this is what you guys look like over here. And I'm the only one in the room whose blood looks like this. Because since 2014, every night, my dog and I have been sleeping on this mat. It's an Asian far infrared that donates negative ions. And so every night, all night long, we electrify our red blood cells, corpuscles. So this is the work from Roger Callahan, who's a TFT man, who is not only a PhD, but he was also a scientist. And he used this rouleau formation, tapping, and then afterwards to prove that he was putting energy into the cells and was getting energy into the red blood cells. It was doing something. This is using the PMF machine, before and after. This is 8 minutes of PMF. This is really important, I think. The red blood cells clumping stops electrons and nitrogen and oxygen from reaching, this is time for demonstration, guys, reaching the circulation. So this is a blood vessel, a small blood vessel. And when you are not clumped, guess what happens? You got flow. But if you have clumped blood, guess what happens? There's no flow distal that in the microcirculation. There's no oxygen. There's no electrons. It just can't get through. And then, of course, the mitochondria will go into the cell danger response. This is one of the ways you can treat clumping, and this is from the earthing pad, and these are a bunch of doctors who came in and they got their blood tested and they sat on the earthing mat for 40 minutes and they all got rid of their clumping. So there we have earthing pads, do it. Roger does it with these far infrared heating pads. They have shown that they stop the clumping, and the PMF pads, no pacemakers please, also stop clumping, because they load up these red blood cells, because inside of the red blood cells is iron, which the oxygen goes into, but that iron attracts the electrons to the surface of the cell. And this is the information from the QRS. The QRS was developed after Urey went up to the Earth and it didn't work very well. Here's an investigation thing. We haven't done any Rouleau clumping test before you do your MEND and then after you do your MEND. Very nice little study. Just use a regular microscope. And the one I would really like to see is when they have a cardiac arrest in the hospital, some little technician comes and does the Rouleau formation, and then they do all their 360 volts of joules of electric energy into the chest, and then you do the clumping afterwards. Because we know that this heart is in arrest because it didn't get any circulation. Okay, everybody take a big breath. Yeah, good, breathing is good. This is Dr. Vanderkolk, who is the grandfather of PTSD. He's wonderful. He's an MD in Boston, has his clinic. And in 2000, he had done the survey. He took all of the CAPS controlled studies, cognitive behavioral therapy, and I don't know what this other one is, but it's a psychological thing. And they measured the CAPS before and the CAPS afterwards, and there was no change in improvement from PTSD symptoms. Prozac in civilians a little bit, and EMDR was the only positive change. CAPS is clinical assessment of psychological symptoms by a PhD, and all they do is they go around and they take these symptoms, and that's what they did with the Marines after they came back from Vietnam. All right, this is, I added on, and Vanderkolk gave me the permission to use this, I added on Dawson Churches. This is his tapping data. This is the active duties. They were at 60, they got down to 40. These are the wives, they were at 40, they got down to 26. And what this slide really tells you is make certain you treat all the family, please. And that was done in that time. And these were in 2017, these are the VA, and it's great wisdom. It's finally got healing touch, and it's finally got emotional freedom technique. They first started doing emotional freedom technique in 1994, and Gary Craig had to retire because they had a heart attack. But that's 23 years of delay between anyway. When they knew that it worked and when the VA finally enlightened itself. Now they are required, the VA is required to have those techniques working by 2018. How much time do I have?
5 minutes and 40 seconds.
No, you have to add on extra minutes for the repair time. Okay, so I found out about the BAUD, and this is the BAUD, which you can look at later. This is George Lindenfeld, who's a clinical psychologist, and this is his data with his first 6 patients he brought, and when I met him, we shared each other's data, and I looked at that and I said, there's something the matter with these 3 guys. And I asked George, well, don't you know how to do ACE, abusive childhood episode scoring? He said, what's that? He's a pediatric clinical psychologist, and he should know this. But it's where, so what he did is he took care of the combat stuff, but he didn't go down to the childhood where we have a whole bunch of root problems. He didn't clear the childhood trauma out. So after he saw that, I told him, he became friends with Dr. Fletty, and now he does ACE scores on everybody, and he routinely gets his CAP scores below 10. The psychologists say that this is normal, and I don't agree, and neither does George. Anyway, this is his blog, And his goal, our goal, is to eliminate combat trauma and suicides. I'm doing the running the point for him because he can't touch anybody because he's a clinical psychologist. He's great. This is his data after he started. These ones are after he started, putting in that cap thing. I mean the ACE thing. And this is the device. It's $495, and you have to get a hold of Rick. And this guy's really cool. And this is 2 batteries, 2 channels, just like the microcurrents, 2 channels, and one dial. You set this, and you think about the terrible, terrible thing, and you set it until your dial makes it even worse, and then you put this dial on to try to neutralize it, so it's not so bad, and then you run it. All right, case 1. A nurse friend of mine asked me to treat her, and so I got to her place, and she was 70, and she had been raped and strangled when she was 10 years old. So, and she'd done a bunch of stuff, but hadn't gotten there. So she got on her massage table with the BAUD running, and she lay there, and I got up on the massage table between her knees in the root chakra, because I spent half my life in the root chakra, and it's like practically don't know where to go. And then I wanted to be there because I wanted the root chakra to know that there was an evil person. And then I pushed on her mons, and she put her knees together. And every time I pushed on her mons, she kept pushing on me. So finally my back started hurting, so I got off the table. I don't ever do that. It's just bad. Then I took my sending hand, I went to her neck, and I pushed on the different points: thyroid, larynx, trachea, carotid, one side or the other. Every time I pushed her, she was fighting me like this, fighting. And that went on for 45 minutes, and pushing on the belly and the insert. Okay, the massage therapist, you'll be proud of me. Anyway, so about 8 weeks afterwards, she called me and said, well, for the first 3 nights when I laid on my back, I started fighting again. But on the 4th night, I didn't fight at all. But I have to tell you that I have the strongest orgasms I have ever had in my life. And I knew I had struck, that was it. We got rid of all the trauma in her coochie. 45 minutes, da-da-da, we acted it out, and the sound wave went in there and cut it off. This one is more important because you can see that's not me. This is a 4-year-old boy who was molested in the bathroom, and he was wetting the bed and couldn't sleep at night, and his mother was very upset. The next year, when he was 6, he started molesting other kids. They took him out of school, they put him in therapy, and hadn't changed. And this wonderful lady GP said, give this to him and tell him it's a magic box. Tell him to think about that bathroom, and I'm going to set this at 2 and 2, and only he can hear it. And I want him to think about this every night for 10 minutes for 10 days. And so after the first night, it was only 8 minutes. He said, Mom, I'm done. And he stopped wetting the bed. And he went to school. And the first day he went to school, he dragged his mother in the bathroom. He says, Mom, I'm not afraid anymore. So this is phonons. Oh, no, you have to listen to this because this is exciting. This is the references.
This is a continuation of my presentation of photons, electrons, and phonons to treat what you call PTSD. This is the end of the presentation, where I am thanking you for your attention, and to note that Operation Firehawk is not for profits. It's devoted to education, research, training, and treatment of combat stress reaction for all medics, medical operatives, and first responders. One of the nurses came up to me at the conference and asked if she could refer her veterans to me so I could treat them. And I said, no. She was a nurse. I said, you go to my website, you spend 90 days practicing the tapping, and you use the protocols, and you treat them. And then you teach someone else to do the same thing. This is about all of the people being empowered to know what to do that's going to work. It's about all of the medics, all the corpsmen, all the special ops medics, all the nurses, all the EMTs learning how to treat PTSD effectively. This is the website with the second one is the Maser drill, which is the 29-minute presentation from about 3 years ago. That was to have that Marine sniper eliminate his PTSD that no one in this country could get rid of. This is my summation of the presentation, and I think it's important for you to start using your photon fingers because energy comes off of your hands that when people who can see energy, they can see it is in color. We added on these slides, which I feel are really important for you to know about for practice, but they were outside of the constraints of the 30-minute case presentation. The add-on slides consisted of the far infrared negative ion PMF mats and chairs, which are from Asia, and the MTHFR methylations, vitamin Bs, microamp settings, which is a really good way to follow the progress of your patients. And yay, 2 new A frequencies. Then there's the PTSD-C, which is a protocol I wrote after Barbara Harris sent me the article on cell danger response. Uses a lot of the A frequency 11 plus, which is mitochondrial energy. Then there's the really important first U.S. Air Force men pain study with a 90% success rate done by novice U.S. Air Force trained providers. And please read the section on the electrons from energy donors to get into the red blood cells that can get into the cell mitochondria and heal pain, chronic and acute electrically. And finally, the mitochondrial fudge recipe. First, the Asian far infrared mats. I found out about these at the FSM conference in February of 2014 from a dentist whose wife, he had to tell me about it. His wife had so much back pain, she had to stop working. After 6 months of her sitting on a jade ion mat for 45 minutes each day, she's energy sensitive, no more than that, her pain reduced by 85%. But the important thing is that her blood pressure, which had been 170 over 100 on 2 meds, became 90 over 60 on no meds. 2 days later, I ordered 2 meds. One for Ziva, who has hip dysplasia and scoliosis, and she had needed microcurrent treatments every 4 to 6 weeks to stay out of pain. And I had deep right hip pain from standing lopsided at the operating room table for 39 years. FSM only stopped that pain for 24 hours. However, after sleeping for 6 months on the mat, my hip pain was gone. And my blood pressure, which had been 140 over 85, was then 125 over 75. And now, after 5 years, it's 110 over 60. Ziva has microcurrent treatments every 4 to 5 months when she overextends. But she's on no meds and she's pain-free. We have tested since 2014 6 different far infrared mats. We sleep all night on the mats to get our dose of electrons and photons. It is important the temperature should not exceed 39 to 38 degrees Celsius because over that, the tissues become dried out and they cause pain. And that's what we found out by sleeping in the biomat all night long at 40 degrees Celsius. I developed pain and I stopped using it and I got healthy line mat that controlled the temperature. The jade tourmaline mesh has flat stones. It's really good. It helps reduce anxiety and it can also be used for high temperature Japanese detox. And call me if you need any help picking out which mat you need. The biomat, which Dr. Cirrus loves, he uses it twice a day sitting on it. This is Healthy Line's brand new amethyst jade tourmaline chair mat, which I got 3 months ago. And I use it when I'm watching the news at night for 20 minutes of PMF. And then I cheat and I do another 20 minutes. And I love it. It is extremely relaxing. It feels like a warm cloud of goose down. It's been wrapped around my shoulders. And I cannot feel energy like the massage therapist in this room can, but this one I can feel. It supports a very deep sleep, but I do not sleep on it. The controller runs the PMF cycle for 20 minutes and then stops for 100 minutes and then it recycles. You could run the 20 minutes before you sleep and you could run the 20 minutes if you wake up. People with pacemakers and pregnancy should not use PMF mats. THFR is a methylation defect. Dr. Bilica had a presentation about this several years ago. He's really an expert. I'm not. But my whole family, I found out, has MTHFR. There is a new book. It's called 85th Percent Solution by Dan Purser, MD, who treats a lot of these patients. And it's a really good book for patients and clinicians. The outstanding information I got from Dan Purser is that he listed 71 conditions that are associated and probably driven by MTHFR, like autism. In OB, we knew about the neural tube defects. We did not know preeclampsia, nor did we know placenta abruption was associated with MTHFR. And then there's Parkinson's and seizure disorders. This is, if you've got anybody who has a complicated medical history, get them tested for MTHFR and send them off to a naturopath who knows how to treat this because it's sort of complicated. Purser also has an MTHFR cookbook to help people at home with this. Now this is, wake up and pay attention, because the subbuzz is a term I developed, and all of my protocols are set at 400 microamps because I'm dealing with veterans and they need a lot of microamps. Most of those veterans, especially if they're in a go-go, will not feel the 400 microamps. But the sub-buzz is the first level where they don't feel buzzing after turning the protocol on and stepping down from 400 microamps. Chart the sub-buzz at the start of each treatment and follow the levels. As the tissue heals, the sub-buzz usually goes down. Or in some energy sensitive, she started up, she could only do 60 microamps, but then after she got well, she could do 100. She was so proud of herself. This gives the patient something that they can see to relate to how their body's feeling. And as I said, all my protocols start at 400 microamps because the warrior's muscles, mitochondria, need more electrons. It took 72,000 microamp minutes that we used to cure the Marine Sniper's go-go, plus tapping. So you can quantify what you're doing with your microcurrent unit. This is really exciting part. This is 2 new wave frequencies. 991 positive, muscle test for 1 to 5 minutes. You put it at the start of the protocol, and it is remove traumatic microtubules, which you've already seen, from the cell membrane. Uses the beginning of each tissue. It's similar to, but not the same as 94 and 294. In fact, you can muscle test and see if you want to add on the 94, the 294 with the 991. The 991 is for fear-generated traumas. The other frequency that's important is 702 positive, muscle test for 1 to 5 minutes. It is restore normal, healthy cell line, structure, and function. And I got it from a Stanford OBGYN who could transmit energies through his hands. He held normal cells in a petri dish and sent this restore normal, healthy cell line, structure, and function into them, and they grew. And then when he held cancer cells in the dish, the cancer cells just died off. This is not a cancer treatment, but what it shows to me is that it will not, 702 positive will not grow cancer cells in the body. And that's what I'm very concerned about using Vitality. Use this at the end of each tissue treated. PTSD CDR protocol. Barbara Harris sent me the article about the cell biologist and the cell danger response. And after reading that article, I sat down and I wrote the PTSD cell danger response protocol to be used to repair the mitochondria. So you use it whenever you feel overwhelmed or drained. I wouldn't recommend it for the acute treatment of the go-go, except you could add it on after the muscle go-go and the abandonment go-go and the concussion go-go were done, and the veteran was getting tired and was out of his hypersympathetic state. And you could run this one at that time. You turn on the protocol, you step down the microamps until you reach their sub-buzz level. It's 130 minutes long. I haven't divided up into 3 units. This protocol clears and relaxes me. It makes me feel like I took a shower on the inside of my body. And you can get a hold of it by emailing me. The next is a report that's really positive. Shannon Goosen took 50 United States Air Force providers and taught them how to use MEND. And then they treated pain, chronic pain, acute pain, surgical pain, these providers, and they had a 90% success rate in removing pain. And the Air Force was so impressed, they're now enlarging the training and the use of this, the MEND pain treatments for the Air Force, which is hopefully wonderful. This is the slide about where do we get electrons from. Remember that only electrons reduce inflammation and pain to heal cells and save lives, which as MEND practitioners, you know that. This comes from my Native American medicine training, and that is Father Sky sends lightning bolts into Mother Earth to keep her heart beating at 7.8 hertz, the Schumann frequency. She gives electrons of life to every living thing. Until Yuri went up and almost died, we did not know the importance of cell voltage received from Mother Earth to stay alive. The ologists finally learned, after years of doing CPR with drugs, that just shocking the arrested mitochondria, that is sending a huge dose of electrons into the 2,500 mitochondria within each heart muscle cell that was restarted. These muscle cells have run out of ATP, energy to contract, and the electrons restored it. Other electron donors, besides lightning and walking on the beach, essential oils, eating fruits, earthing pads, meridian tapping, all the types of meridian tapping, MEND microcurrent, the BAUD phonon, Tenet's biomodulator, are all driven by, and the ProWave energy system is all run off of batteries. Then there's the AC current far infrared and negative ion stone mats, and combined stone mats with PMF. And then there are the whole gambit of PMF, pulsed electromagnetic frequency mats from Germany. The QRS is up in the Russian space station, and the Beamer is up in the United States part of the space station. All of these are EMF protected. And oh yeah, you need to put in loving hugs. Why electrons are important is because as you age, your body loses electrons stored in the batteries, which is in the muscles. And there are 2,000 mitochondria in each muscle cell. Here's 40. At 40, you start to lose your voltage in your muscle cells. So if you start adding PMF or electrons to your body, you can get your batteries up to normal. And what I'm trying to say is if you've got pain, you've got no electrons. Finally, grow your own mitochondria. Mitochondria multiply by extreme exercise, like the Marines do. you multiply by starvation, like in the refugee camps, the concentration camps, and by eating dark chocolate. Yay. So this is a recipe, mitochondrial fudge recipe, and you do not have to put the maple syrup in because the sweetening is stevia, but the cocoa has more PQQ than even breast milk. And that supports mitochondrial biogenesis and protection oxidation. This is my contact information. What's really important in here is the Maser drill from the 9th Annual Microcurrent Conference, where it gives you specific, exact instructions on how you should learn by practicing for 90 days the tapping and how to do the recovery from the go-go using the muscle go-go, the abandonment go-go, and the concussion go-go. All of those protocols and the 7-step handouts, tapping figure, are all available as downloads on my website. If you have any trouble with building up your self-confidence or something, give me a call, because it's all about a muscle memory, learning how to do this, throwing those electrons and phonons in from your body into the patient and recovering them. And now there's finally, this is a reference for all of this material. I want to thank you for your attention, and good luck with your tapping.